I like to, you can do it side bend and rotate away just to check screen for AA. I like to flex because more people tolerate flexion and neck pain than they do side bending. And also a lot easier. So this is one of your cervical flexion, lateral rotation tests. Make sure you don't. One thing people will do is they'll do that as they rotate. They'll drop the head. Don't drop the head. It's nice and steady.
Are you putting her in the max amount of flexion that she has?
Yes. So I've got her fully flexed. And then I'm just letting the nose should go about to the armpit or about 45, 50 degrees.
If they have that much rotation, do you keep going to in range or do you just
Go until she hits the end range right there. So get that infield. Should be nice and bouncy. Should be capsular, little capsular infield. Should be a little firm but bouncy. Some people get a real sharp pain sometimes. They have AA dysfunction. They start pinching bone or something like that. It'll get sharp and also very hard. Infield, so I can just bounce it right there. It's got a little elasticity to it. Dizzy with it. Okay. Sitting there just rolling around. If I get to talking and bouncing your head around, you get dizzy. Just throw up on me once and I'll okay, so one pretty simple way of OA is some people will put their hands here. I put mine here just so I can control the head a little better because I get real sloppy a little bit when I'm here. I've just learned that. That's just my correction. I don't think Dr. Holmes does it here. So you can control the head. And it's just a nod.
It's nice to do it your way though, because if you're going to do muscle energy, you can extend the vertebrae.
You're already there. Yeah. So I like to imagine if there was a stick running through her ears. You want to rotate around that stick. That's about where you're, just right around your OA. So it's my guide. So I'll just pull her into a little bit of chin.
You notice that that's nodding, that there's not a lot of, you're not like doing this, that's lower cervical spine. There's not a lot of motion.
That's it right there. She's a little blocked, a little tight there, which most people will be, just because we spend all of our time
Reading in another.
So that's then for flexion, extension of the OA is right there. You can even bias it to check right, side bend there, left. I know there's a couple other ways you can assess some rotation that I'm going to show you. That's just my quick screen for OA and AA. And side glides. I just use my two index middle finger there.
That's why.
I'm just kind of side bending right there and lift it. I give a little bit of a lift probably there. Probably for you learning, I would do going right to left, come back and do the same level, left to right. You can compare levels then. So there, there. So you shouldn't have to, some people do that. I know when I first learned this was, I started doing that and okay, I can feel it, but it's putting a lot more force into it than is necessary. And also pull you a little bit. The main thing is know where your level is at when you start. So there's her C2. I'm palpate her spinous process. Drop the opposite, down. First spinous process of the head's going to be C2. And most of them here are going to be about one finger width. You have to be careful because you got bifid processes first. C5 a lot of times is really deep, hard to get to. So you might have to tilt up just a little bit. C5 will almost disappear with some people with ever lordosis. Okay. So side glides kind of like what we did the other day on the Friday. So work on. I was telling some people over here, I don't really worry about how you do the side glides. If you do it with fingertips or like the side of your finger, middle finger, as long as you got a good plane motion. So shouldn't be doing a lot of this. Should be pretty much straight across. You have to get your elbow out to make sure your forces stay in the same plane. So we don't want this because a lot of times that's more extension than it is lateral glide. So find what you take best with. Hand size makes a difference. Make a really big pumpkin head. You know, it's a little easier for sometimes their head weighs down and supports their head and keeps them pretty stable. So use that to your advantage. Some people with real little heads, they just flop all over the place.
There's a couple things you might notice is he wasn't lifting the head off the table when he was doing it. You don't have to. You can, I guess.
Yeah.
But I never lift the head off the table when I'm doing side glides.
Now, some people do. You can then go bias it. You can do a flexed.
I don't have the biggest hands, so
Yeah.
that's one of the things I
Yeah.
you know.
An extension always. If you're going to do this in extension, I just lift the head. That's all you have to do. That's extension of the segment. You don't have to extend the whole head. So even with vertebral artery concerns, you can still do extension, and you're still in neutral. You're only extending one segment, so you're not going to cause a vertebral artery.
Remember, it's only motion in one segment. The other thing I might have noticed about Dr. Nichols is he wasn't looking. It's you're feeling motion in that segment. You're not looking to see how much lateral. If you're looking at lateral flexion, you're doing holes.
Y'all have a little different way. They've got a little different way of doing it. Plus, body mechanics wise, they're a little different.
It's all the same. It's just basically force being an issue. So we want to generate different force, whether it's the patient or you. But on the side glides, I was telling people you can start with your fingertips to try to palpate where you're at. I think that helps. I mean, obviously we sense so much better here. So see if you guys can't start there and feel where you're at, and then slide. I mean, I still do that. I start with my fingertips, and then I'll slide down to this spot on my hands, just to give me a placeholder. And then I personally, it's hard for me to hold the head and do two at a time. So I do one at a time, and I hold the head, and then I do my side glides down the right side, and then I switch and go down the left side, and I can come back and I can feel the area that's tight. So if you're having trouble holding the head and doing your glides, try holding the head with one hand and doing the glide with just the right. That helps.
Is that hard for you to prepare, like going back?
No, it's usually not. And a lot of times I'll find it on one side, and then I go down the other side, and you have to make a mental note as you're doing it. And then you can come back to that segment and get a little more isolated and compare, okay, C2, C3 on the right, C2, C3 on the left, yeah, that does look okay. A lot of times with their movement patterns, you already have an idea of what segments you're chasing, and you just go and you're just assessing 2 or 3 segments. I rarely go all the way down the chain. So let's scoot back. So just for the OA flexion, relax your head so you can assess it like he did. So I'm trying to get her chin to just come down, feeling how much resistance I get. If you want to apply more, so these gentlemen were talking about how they're gripping her head and they're mobilizing her here. I find you can assess it and mobilize it with your body. You need more force. So remember, it's occiput on C1, so we're doing convex on concave. So we're gonna bring, her head's gonna roll anteriorly. So which way does it have to glide? Posteriorly. So I'm going to block C1 with my basically like this on the posterior side so it can't glide into extension. And then I use, this is a big towel, so it's gonna be a little awkward. I use my shoulder. So I'm cupping her occiput with my right hand, and then right below my right hand, because we're segment below segment, I'm gonna get on her C1. So I can know my fingers are touching. And I'm just gonna roll her anteriorly and push posteriorly with my shoulder. Assess or mobilize here. And again, that's just more force if you need it. If you feel like you're getting enough with your hands, fine. Anything else Mindy you would add? I'm gonna let Michelle and Emily had something to add too. They saw.
Hey guys, we kind of addressed this half the room, but we want to make sure you guys hear it too. When you're mobilizing, if you don't get a good skin lock, all you're going to be doing is pushing skin and soft tissue around. So there's several different ways you can skin lock to make sure you're actually on the joint that you want to affect. You can either kind of scoop the soft tissue up, or you can push in through the soft tissue and play around with it and see what works for you. You'll probably find you prefer one way or the other. And if you have questions, we'll stop. Oh, also one more thing. Remember that these people are coming to you with pain, most likely, so when you're assessing them, be really slow and deliberate. Don't just jump in and do like a really forceful glide, because they're never going to trust you if you do that.
They're gonna be guarded anyway, for the most part, so you get them to relax. A lot of times, I'll just start with just some, little distraction, little, little massage, little kind of rotate, just kind of work it around a little bit until they get a feel for your hands. Because first thing they do when you start, you put a fingertip right up into this painful joint. Spring, they're gonna go like this, and you're gonna say, okay, yeah, everything's tight. Had a guy yesterday that I saw that was, got severe weight, and he's one you can really get those people that are kind of subacute, they're just severe weight, typically older patients that you can kind of move around a little bit, but still gotta get them used to. Younger, very high intense pain, acute patients are not gonna let you just go in there and do a lot of side glass. They're gonna guard you.
Like I've said this call you a couple of times, but there's a novice to expert range, and we're all novices, right? And I think the more adept you get at this, the more you're able to put pressure and feel what you want to feel without causing pain. When you start, you tend to cause pain. That's why you're doing it on each other. And, but as you gain, one of what I've noticed is as I got better at it, I was able to be firm without, and not firm and not instead of firm and, because you've got to do a little pressure to actually feel the sides